I'm with Dr. Michael Kelly, Director of the Family and School Partnership Program and Associate Professor at Loyola University School of Social Work in Chicago, Illinois. And we're going to be talking about the presentation he gave at Oxford today called Moving Towards a Training and Research Agenda for the Next Generation of School-Based Family Counseling Practitioners, the example of school social work at Loyola University Chicago's Family and School Partnership Program. And Dr. Kelly is now going to give us an overview.
Thank you, Brian. It is a real privilege again to be back here in Oxford to speak to this group and to hopefully share this with some of you that might be tuning in about kind of where I've been working of late with a bunch of other colleagues, and hopefully will continue to work in looking to shape some of the ways that school social workers and really largely school-based family counselors of any discipline are going to need to be trained in the coming generations will need to be trained so that they can do the kind of work that we've been talking about here at the symposium. So the presentation I gave was to, in some ways, elaborate on and build on survey research I actually talked about last year that we did. We did our second national school social work survey, national being in the United States. The survey was done in 2013 and actually wound up having 3,700 responses. Of those responses, and that was the largest sample to date of any school social work survey in the United States, what was important about that sample for us was a couple things. The first is that we did begin to see some shifts in some of the practice behaviors and some of the attitudes towards some of the ideas that are embedded in the school-based family counseling model. The idea of working with community, the idea of involving parents at early stages of the work, not just in the crisis times. The idea of using data to track your outcomes and to make your case for the value of your services. The idea of using available resources online that are evidence-informed to do your work. Those things are beginning to slowly shift for people that have been in the field for fewer than 10 years, that happen to be in states that have certification procedures and that in states that require a master's level credential. However, what we also found, the second item, which is what I spoke to here, was that most of our sample are actually not new to the field, that this is, for whatever reason, school social work, and I would say, based on other surveys I've seen, school mental health in general, appears to attract people that stay for a long time. They stay in the field, they stay in their schools, they stay largely doing a lot of what they learned in graduate school, and not particularly building off of that. And for a lot of reasons, that's problematic. And the things that we learned in this last round of surveys that I addressed in our presentation was the lack of ability for most of the respondents to use data effectively, the lack of the ability for people to be involved in what's often called in our country universal interventions that involve a whole school community or might involve a subset of at-risk kids or parents that need additional help. These are things that the majority of our respondents were saying they either didn't know how to do or didn't feel they had the time to do. More often not the time, but it was also an issue of skill and knowledge. So what I then spoke to is, well, what does this add up to? Because this is not a new finding in the sense that we keep seeing this in the survey work we're doing, and that other disciplines are doing as well, that many school-based mental health professionals are largely spending their time in what I call reactive practice. They're in the response of coming to the office when a kid is in trouble, or they're responding to a family who says, my kid is in crisis, help them. And that work is always going to be a necessary component of what we do, but what kind of things could be in place that the school mental health person could put in place so that fewer kids are called to the office, so that there are fewer opportunities that parents feel in crisis and need to call the school. So those are the things that I've kind of, with my teams, I do the FSPP, the Family School Partnership Program at Loyola. I put a number of teams together to tackle kind of four main areas that I spoke to at the presentation. The first is coming up with online tools that are free, evidence-informed, and easy to use. And all three of those components are really important because there's certainly a lot of evidence-informed tools that are out there. There are certainly things that say they're easy to use, maybe not. There aren't as many things that are free that actually have evidence to support them. There's a lot of things that are just out there on Google. So I shared with the group that I've been asked and given the chance to take over a website, www.schoolsocialwork.net, that by the time a lot of you are seeing this will be relaunched in the fall of 2016. And that's going to be a place where hopefully we achieve that idea of some things that are free, easy to use, and evidence-informed. The second thing that I spoke to was the need for us to develop a network of mentors, because many school social workers, and I would argue many other professionals, once they get out in the field in a school, they will never have a supervisor again, or they'll never have at least a supervisor who did what they did or knows really what they're doing. And what that tends to lead to, in my experience, as well as some of the focus group data we've collected that I also spoke about, is it tends to calcify or freeze the practice behavior, that people basically stay at some set point. They don't move past that because that's all they knew how to do from graduate school, and that's all they know how to do. So they stay there. And we know, obviously, with the way things change and the increased needs that are being shown in schools for kids, that we need to have that be more of a lifelong learning culture. So one of the ways that I thought we could deal with this is to create this network of master mentors who would be able to give of themselves and provide that support. I'm hoping that website I reference will be one of the places that we can link people to together using social media. I'm also hopeful that possibly this Oxford Symposium can help me do that. The third thing that I shared was if we're going to really change practice and we're going to make people better prepared to do the work we know they need to do to be good school-based family counselors, they're going to need to have better field placements. That a lot of what field placements look like in my state of Illinois in the United States is people who are happy to have an intern in part because it's extra labor, or at least they, again, may be training them as best they can, but in sometimes ideas that are fairly 20, 30 years old even. And so how do we create field placements that are vital for what the future of the field is saying? So I shared that I convened, with the help of a lot of other people in my state, all of the schools of social work this July, and we are going to tackle that this year. We're going to try to create basically a list or a descriptor of what we think a really terrific field placement is, what we think that would look like, how we would support that, because what we're going to probably find out once we get out there is that some people are going to say, that sounds really great, either I don't know how to do it or I don't have time to do it. So we're going to need to do something about that. So that's another piece of the work I shared. Kind of the last big thing that I shared that I was just thrilled to show the group was, as part of the Family School Partnership Program, we do a summer institute every year. We had our 11th annual one this year. We had over 140 people, including the presenters, come for 3 days. And what we had done prior to that was had 11 school social workers and school counselors who walked with us through a year-long professional learning community project. And the PLC, Professional Learning Community, focused on them developing a project that they wanted to do to transform their school. And we asked them to specifically look at a need that they thought was really central to their school. It could be a social emotional need, it could be an academic need, it could be a behavioral need, it could be something else related to other practices in their school. We then asked them to say who would be their key allies, who are 3 people important in the school who help you get it done. The third one was, what data are you going to use? How are you going to find out what the real issues are? How are you going to show that what you're doing makes a difference? And then finally, how are you going to keep this on the radar of your school? How are you going to make sure your school knows you're doing this so that when you do it, and it hopefully goes well, you get credit? So that PLC project bore fruit in a couple ways. One way that we're not done with yet is we interviewed those school social workers and school counselors 3 times over the last year to ask them about their sense of self-efficacy, their ability to manage burnout, and their ability to use and think about evidence-based practice. We also interviewed their administrator at the end of the year to ask them how they saw the role of the school mental health and school-based family counselor. And then the final thing I guess I'll end with is that we asked them to voluntarily, they didn't have to present their project to this fairly large group of people, largest group we'd ever had for our summer institute. And we had 9 of them do it. The other 2 didn't do it because they didn't want to. They did it because they couldn't do it because they're out of town. So we had everybody do it, basically. And what they shared was very much warts and all, works in progress. These weren't happy, fairy tale ending type projects. These were things that were about the real life world of schools. But there was also tremendous gains they were already showing and seeing. And what I loved most were two things. That one, the groups were absolutely just absorbed in what they were presenting. We had them do like kind of 3 mini presentations, and people rotated, and they had tons of questions, and they seemed very inspired. But even probably more importantly, in a sense, was what I saw it do to them, that they began to see themselves as school leaders, that they could present their work, that they could be one of those people they go to workshops to hear. They could be that person. So I think what this all ends up for is I go into this next year, and I really want to see how these projects begin to bear fruit. Can we build a website that really does compel people and make people feel like they can do great work? Are we able to create a network of mentors who are willing to give of their time and who have their wisdom to share, and we can build more of a community of practice that way? Can we have professional learning communities, both that we create and also that we help others create? And then finally, can we use the tools we have and all the resources of people that have agreed to do this with me to build better field placements? And I think if we do those things and we do them for a while and we measure the impact of it, I think we could see very different conditions for school-based family counseling in the years to come.
Thank you so much, Dr. Kelly.
Thank you.